That burning in your chest feels like a heart attack. But it's not your heart. It's acid reflux. Acid reflux is one of those health problems that quietly sneaks into everyday life. It often starts small, maybe a burning feeling in the chest after a heavy meal, a sour taste in the mouth at night, or discomfort when lying down. Many people brush it off as normal indigestion, but over time, this can become a frequent and frustrating issue that affects how you eat, sleep, work, and feel throughout the day. If you've ever felt that burning sensation rise up your chest or noticed discomfort after meals, you're not alone, and there's a real reason behind it at its core. Acid reflux happens when stomach acid flows back up into the esophagus. The stomach is designed to handle strong acid, but the esophagus is not. A small muscle at the bottom of the esophagus, called a valve, is supposed to stay tightly closed after food passes into the stomach. When this valve becomes weak or relaxed, acid can move upward, causing irritation and discomfort. This can happen for many reasons, and most of them are tied to modern lifestyle habits. One of the biggest contributors is diet. Large meals, late night, eating spicy foods, fried foods, chocolate, coffee, soda, and alcohol can all trigger reflux by relaxing that valve or increasing stomach acid. Eating too fast, overeating, or lying down soon after a meal also puts pressure on the stomach, making it easier for acid to escape. Stress plays a role too. When stress levels are high, digestion slows down, stomach acid production can change, and the body becomes more sensitive to discomfort. Weight gain is another common factor. Extra pressure around the abdomen can push stomach contents upward, especially when bending over or lying flat. Aging can contribute as well, since muscle tone naturally weakens over time, including the valve that keeps acid where it belongs. Even certain medications, smoking, and lack of physical movement can increase the risk. None of this means you've done something wrong. It simply reflects how closely our bodies respond to daily habits. When acid reflux becomes frequent, it starts to affect daily life in ways that go beyond discomfort. Energy levels often drop because poor digestion and disrupted sleep take a toll on the body. Many people with reflux struggle to fall asleep or stay asleep due to nighttime symptoms, especially when lying flat. Waking up with a sore throat, hoarseness, or coughing can leave you feeling tired before the day even begins. Mood and focus can suffer too. Constant discomfort makes it harder to concentrate at work or enjoy time with family. Some people avoid social situations or certain foods because they fear triggering symptoms. Over time, this can create anxiety around eating, which only adds to the stress already affecting digestion. Physical activity may feel uncomfortable, especially bending or lying exercises, which can limit movement and reduce overall fitness. Long-term untreated acid reflux can irritate the esophagus and lead to ongoing inflammation. While this script focuses on everyday wellness rather than medical treatment, it's important to understand that chronic symptoms should never be ignored. The good news is that for many people, consistent daily habits can dramatically reduce symptoms and restore comfort naturally. The first step toward relief is building awareness around eating habits. Smaller, more frequent meals are easier on digestion than large portions. Eating slowly, chewing thoroughly, and stopping before you feel overly full gives the stomach time to work without excess pressure. Try to finish meals at least 2 to 3 hours before lying down or going to bed. This simple timing change can significantly reduce nighttime reflux. Food choices matter, but they don't need to feel restrictive. Focus on meals that are gentle. On the stomach, lean proteins, vegetables, whole grains, and healthy fats support digestion without overwhelming it. Foods like oatmeal, bananas, rice, leafy greens, and grilled or baked options are often easier to tolerate. Instead of cutting everything out at once, pay attention to how your body responds and make gradual adjustments. Hydration also plays a role. Drinking enough water throughout the day supports digestion, but large amounts of liquid during meals can increase stomach pressure. Sip fluids steadily rather than all at once. Avoid lying down immediately after drinking large amounts, especially in the evening. Daily movement is another powerful tool. Gentle exercise helps food move through the digestive system and reduces pressure in the stomach. Walking after meals, light stretching, and consistent loom-packed activities can make a noticeable difference. Exercise doesn't need to be intense. The goal is regular movement that supports digestion without strain. Posture is often overlooked but incredibly important. Slouching or bending forward after meals can push acid upward. Sitting upright while eating and maintaining good posture throughout the day helps keep stomach contents where they belong. At night, slightly elevating the head and upper body can prevent acid from traveling upward while you sleep. This can be done with supportive pillows or adjusting the bed incline. Mental wellness plays a major role in digestive health. Stress management isn't just about feeling calmer. It directly affects how the digestive system functions. Simple practices like deep breathing, short walks, stretching, journaling, or quiet moments without screens can help the nervous system relax. Even a few minutes a day can improve digestion over time. Sleep habits matter as well. Aim for consistent sleep and wake times. Avoid heavy meals late at night and create a calming evening routine. Reducing screen time before bed and giving your body time to unwind supports both sleep quality and digestive balance. Long-term prevention is about consistency, not perfection. Acid reflux doesn't usually improve overnight, but small, daily changes add up. Paying attention to portion sizes, staying active, managing stress, and listening to your body's signals creates a strong foundation for digestive health. These habits don't just help reflux. They support energy, mood, heart health, and overall wellness. Most importantly, be patient with yourself. Healing takes time, and setbacks happen. Progress comes from understanding your body and responding with care, not frustration. With steady effort, many people find relief and regain confidence in eating, sleeping, and enjoying daily life without constant discomfort. You don't have to live with acid reflux controlling your routine. By making thoughtful, sustainable changes, you can support your digestive system, protect your long-term health, and feel more comfortable in your body every day.